Well, welcome everyone to our Connection Healthcare Technology and Funding panel. This is brought to you in partnership with Poly and Zoom. James Hilliard here, glad to be on board. Really talking to a great panel, and I want to introduce the panel to you first, then give you an idea of what we're going to be talking about, and then really dive on in. We've got an hour. Our biggest challenge is we could probably fill 4 or more hours with some of the topic areas, but we're going to give you some high level, and really at the highest of levels, what we want to do is have a conversation that hopefully sparks conversation for all of you within your organization, and then to be reaching out and talk to us, talk to our partners, and move our healthcare organizations forward. Heidi West is here, head of healthcare for Zoom. We're glad to have her on board. Scott Simmons is here, healthcare specialist from Poly. I've got Dana Satterwhite on board. She's the senior director for Learn, Design, and Apply. They are working with Poly and Zoom in terms of grants partnerships. So glad to have her on board. We'll be talking a lot about funding. In fact, I probably have one question that you'll hear repeated throughout the day here with Dana. It's like, all right, Dana, now how do we fund that? How do we get the money for that? But she's got a lot of other information to share as well. So we're glad to have Dana here. And of course, Cheryl Casale from Connection. She is the director of sales for our healthcare on the enterprise side. So glad to have Cheryl here. Between these 4 folks, 80 plus years of healthcare and technology experience. So a wealth of knowledge, and you're going to hear that come out a great deal in terms of the experiences that they've had, what they've seen in the past, where we are now, and where we want to go. What are we going to cover? Well, we will do a little bit of a kind of trends and status, like some of the good things that we see going on in healthcare today. Then we will touch on a lot of the telehealth changes that we saw, especially because of COVID over the last 12 plus months. And then we're going to be looking at areas where can we optimize in 2021? Where can we set strategy for beyond that? And then what are some cool things and experiences that we might be able to provide to our patients as we move our healthcare organizations forward? So that's the high level. Heidi, I said I wanted to start kind of with some, a little bit of the State of the Union, if you will, on kind of where some good positive aspects are within the healthcare field. There have been a lot of challenges over the last several months, and the healthcare industry just rose to the top and really excelled. And a lot of us have seen that. But I wanted to go around the table, starting with you. What's an area that you see within healthcare right now that just brings that smile, brings that pride to you?
I would have to say with one word, resilience. I think when you looked at this past year, being able to see how people fought through some unprecedented situations and rose to the occasion and had their focus on caring for patients in their communities, I'll bring it to resilience every time.
All right, I appreciate that. Scott, what say you?
Well, along with resilience, I would say ingenuity, right? Never underestimate the power of human creativity, especially when people have tools like they have now. I guess that's the big thing for me, but I would say that this also highlighted the unsung role of the family caregiver. We removed the ability of families to visit their loved ones in health facilities. It just kind of underscored how significant a role that family caregivers play in the health system. So they're the kind of the unpaid heroes of the health system. So I guess that would be the other one.
I just got to tap in there real quick. I have a brother in a nursing home due to an accident, couldn't visit. They had some COVID outbreaks, all that. Zoom was a huge part of me still communicating with him during that time of isolation for him, because they were on much more of a lockdown than any of us can imagine. So I appreciate those comments. Scott, Dana, what's something that you think about our healthcare industry these days and you're just like, wow, right?
Probably along the same lines as Scott and Heidi, but just flexibility and adaptability. We were all thrust into the unknown very quickly and forced to continue the very important work that our healthcare providers provide. So that continuity of operations, shifting in the day-to-day model of how we deliver those services has been amazing to watch.
Cheryl, final thought here, and you've been, again, 25 plus years that this has been part of your life. What brings up that pride these days?
Our superheroes, the compassion and empathy from our frontline workers, our nurses, being a nurse by background, absolutely have gone above and beyond, and everything that's gone on in this past year. And go back to Heidi's point on resiliency, we have seen some amazing things that are going to continue, and how we've changed over the last year to become this new version of healthcare.
Yeah, I don't think it's any surprise to anyone that's listening. So we won't spend a great deal of time here, but it's worth addressing what has changed. And there are numbers. It depends on who you talk to, but 2 years of growth in the first 3 months of the pandemic, or 10 years of growth, and we're further down the line than we ever would have been if this pandemic had not hit. So I want to talk about telehealth, and we're going to start pretty low level in terms of kind of the doctor, nurse, patient telehealth, and I'll really turn to you, Scott. One area that I've been working in the past year is with a lot of cardiothoracic surgeons and folks in that industry, and with their patients, and the idea of remote monitoring and all the things that they were able to do. They had to obviously deal with a lot of telehealth, just seeing their patients remotely. And so that was a big change. What I've experienced there is the practitioners, they really came along and like the ability to reach out to these patients. Some patients that were hesitant early love the fact they don't have to drive 3 hours rurally to some clinic, park far away, labor into the hospital. They can be, connecting with their practitioners remotely. Talk about just kind of where that acceptance is, where you see the services now, the attitudes around it. What are your thoughts?
Well, I think the main thing is that people are now experienced it. COVID forced people to experience telehealth, whether they were from the provider end, just for business continuity. If I could not, if I couldn't see patients in my facility, I was not going to get paid, right? Otherwise, so that's a big part of it. But you're just talking about the volume increase. One of our customers, a large health system, went from doing several hundred direct-to-patient visits a day pre-COVID to 2 orders of magnitude higher. So in the 60,000+ across their health system on a daily basis over a period of several weeks. And that's unbelievable scale, right? 2 orders of magnitude plus up. But one of the things that you mentioned was some of the more complicated, I guess, clinically complicated telemedicine. Like, people think of a lot of the experience has been this direct patient visits, primary care, and maybe you could say urgent care in a way. And that was prior to COVID. The model of direct to patient or in-home telemedicine was really focused on the primary care applications, not so much on more complex or specialty care. And because of the inability for patients to come in to see specialists in person, that was a big driver for direct patient specialty consultation, to the extent that they could do what they could do, right? Because I don't have a number of different monitoring instruments at home, and examination scopes and things like that. I'm limited to. There's a lot I can do with just high quality audio and video, but there's not that extra diagnostic capability that's there. So the specialists really had to jump into the fore. I had a friend of mine who was a cosmetic dermatologist that wasn't, that's all procedure based, right? And because of COVID, they had to relearn how to be a medical dermatologist, right? Because they couldn't do procedures anymore. So right. they actually reopened those old notes from the residency program to remember what it was like to be a medical dermatologist, not just doing procedures. So
Heidi, getting on Zoom was something, and I can again talk with experience. My mom had her first couple of Zoom visits via doctor, and she didn't know what Zoom was. That wasn't her thing. She's like, James, that's what you do. You do those things. I don't do that. But now she does, and became comfortable with that. And that was an area, again, I talked about a little bit about acceptance. This has really become a way of doing things, and I see it as a lot of people accepting it and wanting it. There's a driven demand now by us as medical consumers that we want these types of interactions. Is that what you see as well?
I do see it, and I think the other piece you don't want to lose sight of is that competition is taking aim at traditional care models. So if the competition is focused on the consumer and what the convenience and flexibility creates in a visit. So if you're considering traditional care models versus some flexibility and convenience and virtual care long-term, you really do need to respect the consumer and understand what the expectations are now. There is one of the biggest fears, I think, pre-COVID was consumer acceptance. That ship has sailed. So now it's a matter of, and I say this a lot, have a virtual first mentality and then build a KPI vehicle that looks between virtual and in person. And you'll determine what makes sense from this can be virtual and this can be in person. If you have a virtual first mentality, it's amazing how you'll learn what's capable, what's possible, and then how you create that convenience and flexibility for your consumer.
And Cheryl,
I'm sorry, and to just build on what Heidi was saying, just either listening on the radio, if you listen to commercial radio or watching television, the number of commercials for consumer-focused telehealth services that might be domain specific or specialty specific really tells you something, right?
Yep.
These services would not be out there if there wasn't demand for them, right? And people will, I would expect, will stack these services. They won't go to the traditional health facility like you were talking about. They will seek out help for that particular thing they're interested in. Is that what you're saying, Heidi?
Yeah, and I think if you think about how a traditional care delivery system works, it starts with the primary care provider becoming the front door to this committed patient throughout a care continuum. And now if you've lost that front door access to a patient who has options, it really does create a new kind of competition that I don't think the healthcare systems have seen. So yeah.
Mentality was mentioned by Heidi. Cheryl, that leads into something I know that you've got a passion for, and talking to teams is about having a strategy. And obviously COVID hit and our strategy was survive. That's all we could do, right? It was reactionary. That was the strategy. What I saw was we didn't last in survival mode too long, because we did survive. And then people started saying, okay, what can we do? How do we reset? How do we focus on now? So where do you see the industry as a whole in terms of getting the right mentality, as Heidi brought up, and then moving towards let's strategize now?
So the industry is looking for more ways to enhance the virtual experience that's driven by the consumer. A number of us are seeing the patient being the CEO of the health system. Patients driving the drive to consumerization. We're seeing the change in the leadership of the health system from people that are non-traditional healthcare leaders. We're seeing leaders coming from Disney. We're seeing leaders coming from other technology organizations, and really changing to create that true consumer experience and drive that engaged, immersed care that changes to a concierge type of acute experience, or an enhanced ambulatory experience where monitoring is at the patient's designation, where they are, how they want to see it. And it's really driving that change in the market.
Dana, I mentioned the nursing home. I've seen via Zoom, and I have my first in-person visit coming up later this week. With the rooms are changing. The environment for the patients is changing, and that goes to one of my first questions to you. How do we fund this? How are teams thinking about making those changes? Because we now have the patients, the families demanding a different type of care. Are they thinking about the funding, or are they, we don't know where to start? Dana, what's kind of the mentality that you hear on that finance side?
I think to echo, the progression of this entire conversation, funding follows trends, it follows problems, and it follows need. And I think to your point, James, we started out with this pandemic and everyone was just trying to figure out what works to get us through this temporary need that we all felt in this shift. But I do think the funding is now catching up to helping organizations build that longer term strategy, saying, okay, what is here to stay? What is this going to look like post-pandemic? And the funding is absolutely supporting that shift because it has become more in demand. It's becoming more comfortable for the consumer, and to everyone's point on this panel, more in demand than ever before. People are liking it. And so organizations are now having access to the funds. Funding for telehealth has always existed, but now that everybody's demanding it and the flexibility with the technology is growing and is there, the funding is supporting these shifting models to say, okay, post-pandemic, what do those rooms look like? And what does the funding need to do to support this shift in our delivery models? And what is the technology that is able to do that? So absolutely, the funding will follow, as it always does, the need. And COVID really thrusts that to the top of everybody's spotlight within their organizations to adjust quickly. And to your point again, in the very beginning, we all got money thrown at us and everyone was just trying to, figure out what was going to work for the temporary fix. And now that we've seen this transition into a much longer term solution for future, it's now, more of a strategic conversation on how to leverage the funding that exists and is available to build for that looking ahead, and what does the new model look like?
There was a fair amount of money out there. I'm wondering, has what the funds can be spent on, those regulatory type of issues, those rules regulate, are those adjusting quickly as well to match that? What can you tell us on that front?
Absolutely. And I know Scott and Heidi have spoken to this before as well, but we did relax a lot of the barriers that traditionally did inhibit that transition to more accessible telehealth solutions for organizations because of COVID and the need for us to social distance and prevent viral spread. So a lot of those reimbursement challenges, the ability for people to roll out platforms quickly, did get kind of expedited through the experience of going through COVID. And now that has just opened the floodgates, and we're not able to go back in time. Now that the consumer has demanded it and everybody has gotten more comfortable with it, there's no way that they can say, okay, now let's just go back to how things were. That has been opened up, it has shifted, and it has proven to be successful.
Scott, I see you want to jump in here.
Yeah, it's interesting because people didn't know there was an alternative, right? Because there wasn't enough experience. So people always assume, and part of it is just the way we kind of mystify medicine, right? So we, the medical workers are wearing their priestly robes and they've got the stethoscope around their neck, and they've got XYZ degrees that they're infallible. We need to listen to what. So of course, I'm willing to drive in traffic, find parking, wait interminably in the waiting room, go back to be seen for 5 or 10 minutes, and then repeat the whole thing in reverse. And now that people have, out of necessity, have experienced these virtual encounters, whether it's a telehealth visit or whether it's working from home. I mean, it's much broader than just this clinical part, right? People are, wait, there's an alternative, and so it's for healthcare, but it's also for what work looks like now. What does the workplace look like? What does the school look like? It's once you see that there's an alternative, trying to get people to go back is going to be super difficult, if not impossible, right?
Heidi, the back of house. I mean, that's where Scott's starting to go to as well and started bringing it up. It's not just about, holding a phone up and show me the rash. Yes, that's telehealth. What else is telehealth? It's healthcare professionals working with each other. It's a cardiologist talking to a primary care about a patient together, utilizing tools where they can see each other, hear each other clearly, share those medical records, all of that, right?
Yeah, and I think it even is a good idea to take a step back from that. We're talking about virtual, and there's this idea that virtual is between a doctor and a patient, but the responsibility of a health system today, regardless if it's well-being and preventative through specialty to acute and post and everything in between, home health, it's almost the responsibility to look at every single form of communication, because there are multiple forms of communication throughout health systems to solve for particular niche needs within the health system. And have that, I mentioned the virtual first mentality. that goes throughout the entire care continuum. If you're looking at something and you're trying to determine, is this communication concept antiquated? Is there a way that we can engage more fully and create a better experience for the patient? Could the patient's room finally be what everyone wants it to be and have wanted it to be for years? Because now there's a familiarity from the patient's point of view, the patient's family point of view, as well as the caregivers. What does home health look like? How do we monitor and manage chronic care and disease management? How can that look different? And then you even go beyond provider and think about, what can clinical research look like? What do trials look like today? Now you can expand your footprint because you can monitor patients in trials from a life science perspective. And then you go to payer and you think about, how do you engage your member population in a more meaningful way? So when I think virtual, I really do take a step back. Not that I don't respect and have tremendous focus on that patient to doctor experience and all of the other things you shared. But I think as clinicians and health systems and everyone within the health sector is figuring out, what does virtual mean to me? It actually creates a much broader scope of enhancing the patient experience throughout their journey.
You bring up so many, though, areas for improvement right here that this is bringing about. So now we have to start prioritizing.
Right.
Cheryl, I'm wondering, from your perspective out there meeting with clients and talking to them, what are they starting to prioritize as they think along the lines of Heidi, as they bring this mentality first for being, a telehealth organization? What are they trying to prioritize? Where are they looking right now?
A lot of clients are looking at optimizing what they've brought in and defining what works and what doesn't. What happened was they brought in a number of things that fit a niche solution. So talk to what Heidi was speaking about. A lot of niche solutions came in. They weren't necessarily an enterprise level solution. It didn't work for the entire system. It wasn't a full virtual investment. It didn't encompass all of their digital health needs. So now clients are looking at both the front of the house and the back of the house and how they can incorporate all of their technologies together and enhance the experience not only of their clinicians and their patients, but everyone that's involved in the entire health process, to expand their financial, their operational, and especially their clinical return on their investment, to ensure the optimal outcomes across the entire health system.
Heidi, who sits at the table? Who would you, if you had your way and you were leading a healthcare organization right now, who would you be picking to come to the table and start having these conversations? Who are the must-be's, and then maybe a couple other, yeah, we'd like them too?
Yeah, I think it's your C-suite. I think you can't ignore the vision of the CEO of the organization. I think the CFO from a funding perspective, the CIO, all of these are kind of obvious, as well as, a lot of hospital systems now have chief digital officers and chief technical officers. But then I would also probably include some clinicians. If you have a chief medical officer, I would include them. If you have a chief nursing officer or a chief medical informatics officer, I would bring them to the table. And then I would bring some clinicians who are some power users of the technology, those that may bark the loudest, or those who have tremendous influence on decisions within the health system, and break it down. And, we did talk about different areas of the health system. I would bring somebody in that's maybe responsible for the telemetry and the pieces that go in the home, or I would bring somebody in from ambulatory that drives, what does it look like out here, in the trenches versus what's going on in the health system. If you invest in the whole care continuum, you have to have representation throughout that continuum. And I would even include, if you've got nursing homes or you have anything that's aligned with elder care, allow that to be part of it. Because Scott mentioned earlier, the care provider. I don't think anything was more gut-wrenching to any of us than seeing these nursing homes being locked down and the inability for people to engage with their family members, their parents, their, our most vulnerable and our most isolated. Having that kind of insight into how to enhance an experience to our most vulnerable And then I would also include, I realize this is a big meeting, I'm sorry, big boardroom. But I think rural health is, my passion and vision and mission in life is equitable care for all. It's just kind of what drives me every day. And one of the things I think we understood through the pandemic is our ability to reach out into the rural communities in a very profound way with telehealth and expand availability of specialists, mental health, and any other variable within health to our most isolated populations. I would bring somebody that can speak to the needs of the rural populations and maybe our most vulnerable, maybe our most, if there's a food island or if there's situations from social determinants of health that's screaming for help and care, bring a representative from that experience as well, so you can enhance the entire experience for all.
Dana, I've seen you nodding in a lot of agreement there, and part of me is thinking too that one, we have this big meeting that Heidi has just invited everybody
Very
to.
Big meeting, auditorium.
But then we need to start prioritizing some of the projects that we can win at, because I do know limited, but I've heard the stories that sometimes going after some of these grants can be difficult. If you're at a smaller organization, you're focused more on the patient care, you might not spend as much time on the grant writing. And so where can people get that help? How do they prioritize where they can get some successful good wins, and then it kind of whets the appetite where they want to go for more?
Right. Well, I loved everything Heidi was just saying, and I will just start by saying that the strongest grant projects that I work on use the funding for lots of different purposes across lots of different areas within a system. So for example, in say a rural health system, if they started their project design around the need for, one specific area of specialty care, but then they start inviting in things like EMS and working with the local first responders. And then they look at, we need a better communication system in general internally so that we can make sure that our administrative services are supported. Those are going to be your stronger projects. That being said, not all grants are going to fund all components. So to your point, James, my number one recommendation for how to figure out the best strategy in pursuing some of these funds is to go for the right grant. Figure out which program aligns most closely with who you are as an organization to define your eligibility and your competitiveness, because you're going to have a lot easier time writing for the grant that basically is looking to fund your type of organization first and foremost, rather than trying to squeeze your application into 6 different grants, throwing them all at the wall and hoping that one of them gets funded. But being more strategic in your pursuit of funding, knowing that there are resources like our team to help define which grants are going to be the best use of organizations' time and which ones are going to cover their needs most specifically. You talk about rural health. I mean, there's just so much funding for that. And my team has been doing this for a really long time. We have always followed funding that really does focus on bringing in those resources to rural communities, whether it's in the healthcare education side and education to the public around healthcare, or clinical telehealth applications. Those grants still exist, and now there's just even more funding available. So again, it's a matter of pointing people in the right direction to which bucket of funding they should pursue, so that they aren't spinning their wheels on each and every funding opportunity, but going for the one that they're going to have the best chance of getting funded at. So they're not taking too many of their resources and pointing them in, in the hopes that they might get something out of it.
Scott.
Just to build on something that Dana said, I'm a former recipient of grant funds for several rural and urban successful telemedicine programs. And I think the thing that we always did that was successful, and I would continue this out, is to think, don't think the short term. You got to think of, I almost think of it as like an infrastructure investment in a way. So where do you get the most bang for the buck, or what kind of sets the framework for you to build on, right? What's the foundation, so, and I think that's why a lot of these grant programs are for capital equipment, right? So, and more infrastructure investment. So whether that's platform investment like Zoom, or a hardware investment like a lot of the Poly solutions, or telecommunications infrastructure investment, or facility improvements to enable these services. Those are all sorts of things that are long lasting, right? And I mentioned I just briefly touched on the platform investment, but that's a big enabler in the strategy, right? So if you put this dream team that Heidi's talking about putting together, is to find commonality of platform is so important, because there is familiar experience across all those touch points. So whether it's the clinical, the direct to patient clinical experience, or whether I'm using the service to meet with a customer service representative, let's say, like insurance eligibility, finding out where to go for labs, all these other little things that are hard enough to do in person, right? In a big complex health facility are now being done virtually, or that should be in the plan. That should be in the plan too. But one of the additional people is to have at the table is the director of patient experience, right? Mm-hmm. If you have that, because that's a huge part of this too, is the I don't want to say the soft part of this, but it's super important, is what the overall experience is, because that's the brand for your health product. I mean, is the patient experience, right? It's such a big part of this. And we talked earlier about this, you didn't call it this, James, but there was really this Wild West approach. COVID hit, and it's like, grab what you can and from the office and go home, or here's a credit to whatever online service you can buy, headsets or cameras, or just take your laptop, do that. And what we found is that we've all found this, is that that's a subpar experience, right? Because and I'm not going to direct this towards Polly specifically, but I mean, there's a lot of these things that in terms of background noise and distraction and poor lighting and all these production elements that are huge in terms of productivity and conveying a sense of professionalism, making a better patient interaction. I've told this story a few times, but I only think maybe Dana's heard this story. Is that I have a lot of friends who are dermatologists, right, for whatever reason. But I had a friend of mine that was doing pediatric dermatology during COVID, and she's providing a consult for the child's in the back seat of the car while the mom's holding her phone, doing this behind the wheel, right? I think she had actually pulled over. She said, "I cannot continue until you pull over," but it's really it's really something, isn't it? How far we've come in a short time,
In a short time. You saw me looking around here. I was trying to see if I still had it at reach. Just after COVID hits, my webcam dies. So I jump online and can I find any, Poly products? Nope, because I was late to the game and a lot of things got sold out. And obviously we've been able to refresh our inventory out there, and so we can get some good hardware these days. But I had to order some just off brand from something somewhere. It lasted me about 2 months and then was out. And I don't want to have my doctor, if I was doing that, rely on that imagery, right, to say what something was. So it is important, the right hardware, the right platforms. I want to talk platform in a moment with you, Heidi, but first, Cheryl, as Scott was bringing up these foundational platforms, obviously the digital transformation was happening in the healthcare space, and then obviously there was a little derailment in terms of we had to react, but now we're back to trying to optimize and get there. But pre-COVID, were you optimistic that a lot of organizations were moving on the right path? They had the right mindset to get these foundational technologies taken care of and in place, so that then we could support the new modern platform, the new modern hardware?
Pre-COVID, we were already down the path to a digital revolution. We were setting the stage where we were creating a journey. What COVID did was it took that journey, and instead of it being over a number of years, it accelerated it. And we were into light years in minutes. And everything came fast and furious, and we had no option but to react. And James, the same experience you had with the webcam, our healthcare clients had it, the doctors had it. There was no inventory. Everything was out there, and we made sure that we were able to get anything and everything to any client that needed anything. And we still do that. But what we've seen as part of this whole transformation is going back to disparity with patients and inclusion and population health initiatives, which we've been trying to get to for years. And we've seen the data sharing. COVID brought that data sharing together to get to one unified record and share that experience and all of that information seamlessly. And from a research perspective, from a patient perspective, that's data that wasn't necessarily shared seamlessly before. And that helps in the treatment and the advancement of the patients. That's also helping us advance in population health and this disparity that continues to be there with patients. Additionally, it's the sharing of technology best practices throughout the continuum of care. And there's no barriers there anymore. It's driving that change. This is what's working for me. This is how we're going to advance. And everyone's coming together as one community, whether it's in a public health system, a public health entity, or it's within a private practice or an IDN. Everyone's coming together. Healthcare has truly changed. Some of the things that are continuing to change is we're still having challenges with behavioral health and opioid addiction, which virtual care is breaking down those barriers. And as we advance this and with our grant support, we will continue to be able to break down those barriers.
Platform. Heidi, I can tell the audience that I was an early Zoom adopter because I've been doing webinars and webcasts and all this type of stuff like 15 plus years. And a lot of the older programs and platforms that were out there, they were great. They were pioneering when they started, and then they bolted on a lot of stuff. And to me, they became Frankensteins and just kind of complicated. And then Zoom comes along and just was easy. And for someone in my world to facilitate these conversations, everything, it just became easy for me. What I never thought of Zoom as was a healthcare platform, right? And then all of a sudden, it was, again, back to my brother's situation, that was what they standardized on and using that for the visits. So I'd love to get at a high level, your kind of overall thought about the responsibility that Zoom has and where Zoom sees itself as part of the healthcare community, as a platform.
Right. I think the one thing we heard loud and clear, and everyone's touched on this in one form or another, is that there are these niche situations, and then there's the whole continuum. And what the expectations are, and what we've heard from our clients is, don't become another telehealth company that is self-contained and creates parallel workflows or additional costs, duplicates efforts. The more you can integrate into our current workflows and become part of the experience, the technology, the foundation we're talking about, this platform almost becomes invisible so people can focus on what it is they're doing, the care, the delivery, the engagement. So a lot of the focus of what Zoom is investing in is these partnerships and integrations so that you're solving for different pieces along that care continuum and not having to have all this duplicative experience and paying for things multiple times. The other piece I would say, from a platform delivery perspective, or who you want to partner with, we were one of the solutions that people chose quickly. We were already integrated with some of the EHRs, so it was just sort of, we'll do that. And we learned a lot this past year. Our clients are not afraid to share what they would like to see in enhancements and improvements. So our goal here to be relevant and to be respected within this healthcare space is a combination of enhancing our client to serve the healthcare space, and also these partnerships and integrations that allow Zoom to fit within existing workflows versus creating additional ones or creating complexity within the experience.
Can you share what some of the top wishes are that you're hearing from customers out there and things that they'd really love to see? Is that anything that can be shared with us?
Probably not in specific terms, but I think it's safe to say when you're looking, it just comes down to the workflow, and it comes down to creating a frictionless experience between the patient and the provider, or whoever is connected in a in a communication or an engagement on a virtual experience. I think there's any kind of opportunity with Zoom's platform being open with open APIs and SDKs. We have the ability to bring in additional support. If you need interpretive services, we have a partner, we're integrated with Stratus. So a lot of that is already in place. And it's almost as people come to us and say, can you solve for X? The response is, if they have open APIs and are willing to work with us or have this SDK we can work with, let's investigate. So it's really, I think our open platform serves a tremendous need in creating that collective experience throughout care. I do think that's a big part of it. But the other thing I would say, when you think about again, I don't want to lose sight of the consumer in all of these discussions. And I don't want to lose sight of this foundation component that the infrastructure, and why a lot of the grants and funds are focused on infrastructure. With digital transformation, it's everything from the digital front door, digital footwall, doing AI and ML and all these letter alphabet situations that are all amazing and incredible and can create data-driven precision medicine, all good things. But if you lose sight of the foundation and the platform and the workflows and the use cases tying together and creating a ubiquitous experience that's familiar throughout the care continuum, a lot of those things are going to struggle along the way. And now with that, we can, kind of to Cheryl's point, we can finally realize true digital transformation because the foundation is in place. The consumers are comfortable with the technology. They're familiar with it. Their family members are familiar with it. And now you build true digital transformation on this foundation of the platform that supports it.
I love the word you use, the frictionless. That was one of the reasons in my world that I adopted Zoom quickly, because I didn't have to train people anymore. That was the bottom line. Click the link, get on, we're good. And we could get down to business. And so, and even more so important outside of, marketing and things that I do into the healthcare space, you don't need to have worried home caregivers with their loved one right there struggling with these technologies. Scott, same thing. I know there are lots of advancements, and your team on the hardware side, I can only assume, are thinking, how can we get better images? How can we get better audio, right? How can we make that experience just so much more inclusive? How can we give bigger field of view so you don't have family members cramming in and doing things like that, right?
Well, it comes to, I'll borrow the friction word that Heidi brought up, because that's one of my favorites, especially as it applies to healthcare, because we talk about the virtual. I won't just say telehealth. We talk about the virtual. What are all the sources of friction in the health system? Mm-hmm. Right. A lot of it is the stuff I was talking about before. It's the care is provided where and when it's convenient for the person who's providing the care. It's not for the patient. Right. And this, the virtual tips that on its head. Right. It's bringing it closer and closer to the patient. Right. But just from the poly standpoint, where are the sources of friction from, the things that we address? I've mentioned some of those as well too, in terms of some of the audio innovations, filtering out background noise. And we've got this technology called acoustic fence, where it's basically, I like to call it a cone of silence, right? Where I can basically block out all noise outside of this cone. But then on the, in the video systems, things like some of the production like features that we have in our video endpoints that take the place of multiple cameramen, and so speaker tracking, framing the speakers, automatically. If someone's engaging in a bigger conversation, it frames a bigger group, or it follows you up to a whiteboard while you're presenting. All those sorts of things. It's removing friction associated with that part. But the bigger issue of friction, I think, is kind of what we're all talking about today. It's this virtual collaboration, I guess, is a lubricant, right? So because it removes a lot of that friction. I've actually used that
I
one
like
before.
that. I like that.
But it's funny that, you know, I've been doing this telehealth stuff for like 30 years, and I've kind of joked that the beginning of every year I'm like, this is the year that's going to take off, and it never does. And then it was this COVID that was just like, you know, this black swan event that was, you know, this left hook that just came out of nowhere that was doing it. And now my family knows what I do,
Yeah, you don't have to
right?
explain
Because
it
they've
to them
actually
anymore.
had these visits, you know. I've been in this, like I said, I've been telehealth for decades. My family, none of my family members ever had a telehealth visit before, right? Now everybody, from my mother-in-law to my kids to my wife to, you know, my aunts and uncles, the extended family, that they've all experienced it, right? So they have at least a small sense of what it can and could be. Right?
Well, let's slide into that again. You know, in my family, my wife is a marriage family therapist, and you can imagine her telehealth visits took off. And she likes her notes, and she likes to be patient facing. And there are some reasons why that still needs to happen, but she also was able to really adjust to her patients and deal with that in the telehealth front and in terms of seeing patients. Let's talk about, and we have about 10 minutes or so. Let's talk about, and Heidi, I'll start with you, and then Scott come your way, then probably Cheryl, and wrap up with Dana. And Dana, I got a couple of the questions on finance that we'll wrap up with as well. But let's talk about what's next. And you can take it in whichever way each of you wants to go. I'll lay out two potential avenues. One, it's the pie in the sky, the what could, imagine if type of what's next, or the, hey, did you know there are other teams already doing this? So it's the like right now, here and now, what's next? The future is the present. So Heidi, I start with you. What's next?
Yeah, I'm going to use the Domino's pizza example. You know, we've been talking about the consumer and what consumers' expectations are. If you buy a Domino's pizza, you know the person who is making your pizza, you know when it went in the oven, you know when it's being boxed up, you know who's delivering it, and then you follow the pizza all the way to your house. If you don't want them to ring the doorbell, they take a picture of your pizza and they text it to you. You know everything along the way. Can you imagine if through say you're in an acute care setting and you're sitting in that hospital bed, and if anyone's had that experience, it's lonely, it's confusing, you don't know what's going on. There's long periods of time where you don't know what's going on. Imagine if you had a monitor or some type of device within the patient's room, and we've all been trying to figure out the patient's room forever. But what if they see care process or care progress, and they can say, your labs are now with our pathologist, Dr. blah, blah, blah. Your nurse on shift today is, you know, and this is their name. And your next test is going to be within these hours, or something where they are part of the process. They know then everything. If you think about when you're in a hospital, do you even really know what anyone's name is? People tend to talk over you or around you, and then have sort of that quick, and you know, and there's people you don't know who they are. I think if you think of the Domino's pizza example and have the entire care continuum include you at the center of who's involved in my care and every piece along the way, just imagine that, and what a great patient experience that would be. Other industries are doing it, and consumers have a much higher degree of expectation now that they've seen what's possible.
Scott, what's next?
Well, I'll take the more short term, because I do think that's the end state, you know, and it's amazing. Yeah, I'd like to do that. We just had some food delivered. It wasn't Domino's, it was something else. I don't remember what it was, but yeah, Miguel is now finished preparing your pizza, and you know, Heidi is picking it up now, and we'll be there. Yeah, this is one example, just to build on what Heidi was saying again. Not nearly as complex as what Heidi was talking about, but I remember, I don't know, it was 10 or 15 years ago, my wife went in, had a mammogram. She gets a call from the office. They said, there's something suspicious on your mammogram. We can't tell you over the phone. We have to tell you in person. Well, when can you see me? The next available appointment is in 10 days, right? So she is agonizing for the next 10 days. We all were worried that she had breast cancer and all that. And it turns out 10 days later, she goes in, it was benign, right? It was something that was suspicious, but it was benign. That's what the radiologist said. that's just one of billions of examples of these sorts of things that are just fundamentally flawed in the way the healthcare system works now. So that's one step on the fixing that is one step on the road to where Heidi's going. Things that we're observing just in talking to customers now is we focus mostly on the clinical part of this, but the fact of the matter is something around 40% of employees in health systems are purely administrative, right? So, and maybe this is a source for funding some of this stuff, is the capital construction projects we were going to do to build the new administrative building or do this. Maybe that gets rerouted into digital infrastructure, but people are, they're figuring out the return to work strategy. If they haven't figured it out already, they're well on the way to doing the process, and it will be at least partially including people spending a significant amount of time working from home, right? Especially for the administrative employees. The other thing is that people are talking, this comes back to the platform, people are coming to realize now that bills are coming due for various platform services during COVID. They're going, we were reluctant before to consider cloud-based voice or cloud-based telephony, right? But that bill for that PBX system is coming due now. We went over to the cloud for video. Maybe we should rethink that reluctance we had to doing it for voice now. And Zoom phone is just an example of that, because you heard the horror stories of people trying to put these people that are working from home on their own personal cell phones because they couldn't get that PBX IP phone on on the right kind of VPN to make it work like they were in the office. It just wouldn't work. Well, with cloud-based telephony, you solve a lot of that. So those are just two examples, but maybe the third is just the answer is, I don't know, because all this creativity we talked about before is really forcing people to rethink, well, do I need to have somebody at every desk at every clinic in this facility, or can somebody else, or can somebody else greet them or be the first step? Or can someone virtually take vitals with a kiosk and not have to do that part and have the nurse do that part of the step? I mean, there's all these things. What does the waiting room of the future look like? What does the reception office look like in the future? What does the doctor's office look like in the future? This is all in the process of changing. I don't know what it's going to look like, but I'm excited about where it's going to end up. And I do think we're going towards what Heidi was talking about before.
And I have to say, I don't think it's that far off, because the hospital system already knows the workflow. They know all the people. All I'm saying is allow the patient to be part of that experience, and don't treat them as though the consumer is irrelevant in the care they're receiving and who's part of it. So I might disagree with you a little bit. It's not that far off. It's just allowing them to be part of the experience.
Well, that may be why I was saying that is, yeah,
so far off. Yeah,
is allowing open access to that to patients. Right. Might be, it's more of a human issue. That it's definitely not a technology issue. It's more kind of a human.
It's people process.
It's right, a layer 8 issue.
It's layer 8, no question.
Yeah.
Cheryl, 2 minutes. What's next?
Come out with it.
I'll make it really quick. And last time you and I were together was January 2020. And I leveraged technology, and it was Zoom, and it was through my regular healthcare provider down in West Palm Beach. And it was for a telehealth visit, a sick visit, got my prescription through a CVS, not a healthcare hub, and was able to leverage Lyft with my Lyft driver, Jervis, and went and got my care all in under an hour. That's our consumerization of medicine. And that's how it's going to be empowered. And it's going to be quicker, and it's going to be faster, and it's going to be less expensive, and there's going to be full transparency. That's what's next. And it's already started. It's going to be through the continuum of care. Though not just in the health system, it's going to be part of the payers, and it's going to definitely be everywhere. That's what's next. And prices are going to change for consumers, and there's going to be a full technology shift. There is going to be more cloud, and there's going to be more ways for us to enter Dana to pay for it.
There you go, Dana. How do we pay for it? What's next on that front?
I think in general, when you think about all of these needs and the trends and the direction everything's going, consistently in funding, COVID aside, but in grant funding in general, sustainability and adoption are always key to your program success. And when you're asking for federal dollars to support it, you have to justify that need and give examples of why it will be successful. And so I think to Heidi and Scott's earlier points about standardizing on platforms, if you can leverage technology to address many of your needs, you're going to drive adoption very quickly. If you go for a platform or a solution that is easy to adopt, both on the consumer side and throughout your organization, no matter what role you play within the organization, you're going to optimize your chances of success with adoption, but also that sustainability. If you start out with a grant focused on addressing opioid services and mental health, but then later you want to expand and bring in other kinds of providers and other kinds of specialty care, if you've standardized on something that isn't just for that one specific purpose, but it can be expanded out with the addition of other technologies. I think Heidi touched on that beautifully, where if you set that infrastructure and that platform and build on it with the tools you need for whatever necessary additions you're bringing in, you're going to build that story of sustainability. And when it comes to grant funding, like I mentioned earlier, there is so much funding for these types of initiatives right now, and it's a matter of finding the right program to pursue, understanding which of your programs are ready to go for certain grant applications, but then looking at it big picture. Back to Heidi's really large meeting with everybody in it, you want to make sure that you're touching on all of their needs, even if the grant you're pursuing is for one portion of that, because ultimately you are going to want to have to drive that sustainability and that adoption, and you want it to be easy for everyone to continue to grow across the organization, whether it's internal communications or you're expanding into different providers and different services. If you can make it easy for everyone and it's the same language across the board and you're just growing it and expanding it with new tools, that's a lot easier and a lot better place to start growing.
I told folks that we could talk about this for 4 hours. We've done 1 hour. Here's my suggestion for hour 2. This goes to your organizations. Spend an hour looking at all those schedules to get the meetings scheduled that Heidi suggested. Okay, that's hour number 2 that you're going to spend. Then hour number 3, that's going to be that meeting. Start talking about where are you? Take that inventory. Where are we? Where were we on our digital transformation? Where are we with our foundational technology? Then start asking some of these what ifs. That 4th hour, then reach out to if you're a connection customer, your enterprise account executives, right? Get that conversation then going on with Cheryl and her team. Who can they mix in? Scott and Heidi's teams can come on in, talk to you about the platforms, talk to you about the technologies. Then you're thinking, okay, we want to fund this, but we were only thinking this. I can almost guarantee you that Dana and team can help expand that mindset so that you are not just narrowly focused on one little thing, but you can branch it out for better success on receiving a winning grant and getting that funding in. So those are your next couple of hours spent on this type of conversation. We hope you all enjoyed this hour. We hope we got you thinking out there about things that you want to focus on. Again, the goal for everyone out here is to continue to celebrate the healthcare industry, the strides that they have been making, and you all really have been making, but now it's optimize it. Now it's move it forward. Now it's get it to that modern healthcare world that the consumers are demanding, and that you all as the practitioners out there in all forms want to deliver. So with that, we're going to wrap things up. Again, reach out to your enterprise account executives to schedule more of these conversations. To Scott, to Heidi, Cheryl, and Dana, really appreciate the time. Everyone viewing, appreciate your time as well. We all hope that you will be well, be safe, and we do look forward to talking to you all down the road.